Hello and good morning. Welcome to Joy in Our Town. I'm Crystal Rome. In today's health segment, part 1, we're going to be talking about natural cures and ways to avoid sickness and disease. In the next segment, we're going to be looking at how to shed those pounds and how to not become a statistic of America's supersize me epidemic. Right now, I am so honored to introduce to you Dr. Angela Miller. Thank you so much for being here today.
Thank you.
And so I'm so excited about this. This is what I love, all this good food that's on this table, but we'll get to that later.
Okay.
But right now, I just wanted to ask you, first let's talk about disease. What are the main causes of disease?
There are 5 main causes of disease. The first one is diet, which, like you mentioned, we'll talk about in depth in a little while. The second one is actually allergies. The third would be microbes or infectious diseases.
Okay.
And then you have toxins. And lastly, stress are the major causes of disease.
And so what way in diet is a major cause?
The dietary factors would be eating processed food, fast food, fried food, versus eating more wholesome food, organic food, and the like.
And let's first talk about the contributing factors to sickness and illnesses. I know, is there one that's more important than the others that we should look out for, or they're all, you're saying these are all equally items, like diet, chronic stress, microbes, toxins, those are all part of it. Is there one more than the other that we should look out for?
Well, the diet is the most important factor because it's one of the things that we can easily correct.
What we're putting into our bodies.
What we're putting into our body.
Right. And so give me some examples of microbes. What are some examples when you say that?
Well, microbes are different types of infections, and pretty much worldwide there's been a problem with infectious disease such as HIV, AIDS, sexually transmitted diseases, tuberculosis with resistant strains, dysentery, where a lot of the children die from dehydration in the more third world countries or rural areas. And the way we like to address treating the microbes is primarily prevention. Sanitizing your hands, good oral hygiene, and then there's supplements you can take to help boost your immune system, which would include things like probiotics.
I take those every day.
And tea tree oil, more natural remedies, because the more we use antibiotics, the more resistant the strains become. And then when we finally really do need something for an infection, the antibiotics won't work. And unfortunately, a lot of our animals are treated with antibiotics, and then we eat the animals and it becomes a vicious cycle.
Right, and we can be getting parasites from different meats, and so you have to be really careful as far as what meats you're eating, and try to stay away from pork. Is that correct?
That's absolutely correct.
Yeah, so it's one of the dirtiest animals.
It's one of the most offending
Stay away from it.
Animals.
And then as far as toxins, it's all around us, and what do we do to get rid of toxins that are in the air?
Well, toxins is really a huge problem, and unfortunately the toxins are in our water supply. And once they're in your water supply, then they become embedded in your foods, especially things that grow underground. And then you have toxins in the environment with your electromagnetic fields, the greenhouse effect. And then there was a very popular case where we had Erin Brockovich, who was just basically an uneducated mom who was the attorney. And she was able to uncover through her hard work and dedication, and it actually concerned about her environment, that there was contamination by PG&E near San Francisco, and there were over 198 cases of cancer within a 2-by-1 mile area.
Wow.
So that's another huge example of how the toxins are pretty prevalent in our environment. And of course, then you have pesticides that the animals eat, and the pesticides are embedded in the fat of the animal tissue. So when you eat meat, you want to make sure you cut off that lean fat, because the animals can't get rid of it. It's stored in their fat, and then we eat it, and it gets stored in our fat.
And grass-fed is a far better option, right? Because
absolutely,
you're staying away from all of the hormones and
and the hormones, the antibiotics.
Yes, yes, all of that's good stuff.
Right.
So as far as allergies go, all the allergens, How does that cause disease?
Well, when you have allergies, the most obvious ones are you sneeze, cough, itchy eyes, runny nose, but also it requires your immune system to fight back the allergies. And when your immune system is being taxed all the time, when you do get an illness or you get a microbe or you pick up some type of infection or cancer, it's just much harder for the body to fight that. And oftentimes the allergies are from things we eat all the time. So people, even if you're eating healthy, like oatmeal or wheat is a very popular one, so is dairy, that you develop allergies to it or antibodies, and you may not realize that you have a reaction to that given food because the symptoms may be delayed by up to 2 weeks.
Wow, so that can actually, cause you to get more sick, is what you're saying.
Right.
By not having blood work done or finding out what allergies you have to foods and all of that.
And oftentimes the blood tests that are done are pretty standard, and it usually requires, at least from my experience, a specialty lab that will check the patient's antibodies for an immediate reaction. So like peanuts, you know, you have a reaction, your throat is swollen, you can't breathe, that one's pretty straightforward. But when you have symptoms like bloating and chronic fatigue, you may not associate it with food at all or difficulty losing weight.
Right.
Then you need a specialty lab that will look at the delayed antibodies that may be manifesting as something else.
Yeah, that'd be pretty hard to figure out maybe sometimes.
Right.
And okay, this term diabetes, am I saying that right?
Correct.
Because I've heard of obesity, but what is diabetes?
Diabetes is a term that was developed by a Dr. Kaufman, and what it is it's a combination of the word diabetes with obesity. So that's how they came up with diabetes. Right.
Okay, and is that, so it's really kind of the same thing, but only with diet? We're talking about diet and obesity?
No, diabetes. So when a person has diabetes, they have an elevation in their blood sugar.
Right.
And the majority of people who have diabetes don't have any symptoms at all. So there's 1.7 billion people in the world with diabetes.
Wow.
And there's 100 million people in the United States. It gets better. 100 million in the United States that have it. And out of that 100 million, 50% are over the age of 65. So our elderly patients have the diabetes. And I lost my train of thought.
It can be a big problem, yeah. You know, and you told me to watch that Forks Over Knives.
Yes.
Which I do recommend.
Right.
And I was just amazed that parents are outliving their children. Just hearing that, parents are outliving their kids, you know, and
right, as of 2011, 50% of the United States population is obese. And so when you're obese, then that in turn causes, you know, increases your susceptibility to becoming diabetic.
And so why is it a health concern? Just tell us the health concerns with being obese or overweight.
Well, diabetes is a spectrum from elevated blood sugar all the way to full-blown type 2 diabetes. And what happens is when you have an epidemic of overeating calories, which are nutrient poor and calorie high, then you have a situation where it perpetuates itself. So countries like Japan or China or even the Philippines, where they didn't have a high incidence of chronic diseases, cancer, high blood pressure, coronary artery disease, later when they were exposed to the Western diet, that all changed. And then those countries start developing chronic illnesses. So in essence, what we have here is a worldwide epidemic that can be controlled with something just as simple and basic as diet.
Right.
In which case you wouldn't have to do surgery, you wouldn't have to take so many prescription medications. And then who profits from all this?
Right.
And when you realize where you follow the money, then you find out how much do we really want these patients to get well? Do we really want them off their pharmaceutical drugs?
Right.
Do we want to stop doing surgery? Do we want to empty out our hospitals? So if a big portion of our GDP is healthcare, there's some strong lobbyists who are moving the pieces and even work for the Department of Agriculture, and they sit on the board and they make the dietary recommendations. So there's a definite conflict of interest, but that's what's going on.
And we need to be told that. America needs to know you can eat good foods and it can cure diseases and sickness and illnesses and
Right. Cure. So we have prevent, because that always comes first.
prevention.
Prevent.
Yep.
Then we cure. Then we treat illnesses with medicine.
Yes.
And then the full spectrum. So we're talking cancer, diabetes, heart disease, you know, the top killers of the world. And then not only that, but actual reversal of heart disease, which was seen on imaging scans. Like they would do a heart scan where they inject the dye in the blood vessels. And by doing that, you have before and after that was strictly through a plant-based diet.
So then when someone is diagnosed with obesity or or diabetes, how do you prevent it or treat it at that point? How do you treat that?
Well, the recommendation first and foremost before considering any prescription drugs is you sit down and you say, tell me exactly everything you're eating, everything you're drinking, and don't be fooled by diet sodas. Because with diet sodas, unfortunately, if you have one diet soda per day for a year, you gain additional 18 pounds. You gain weight from diet sodas.
And I've had people say, well, I only drink, I'm like, don't drink the diet, it's bad,
Right.
it's worse than drinking regular, you know.
Exactly.
Not that regular is good either, but they're like, oh, I only drink one a day, but still.
That's 18 pounds
that
a year.
can still make a huge difference.
Right. Now, if you switch that and you replace the same diet soda with water, you actually lose 24 pounds a year. Because when you eat the artificial sweeteners, what happens is your body starts craving sugar, so you end up eating more.
Man, that's that's huge.
Pretty discouraging.
Yeah,
And it's
I
no
think
wonder
everyone
people,
that just heard that went, what?
right. It's no wonder people are confused. You don't know what to do. One day you get this recommendation, and then you get that, and it's pretty confusing.
Yeah. So how does conventional medicine treat, differ from this way of treating?
Prescriptions,
Yep. That's about it, right?
Medication,
medication,
surgery, and sign your will. This is it for you. We have no more options. And this is never even a conversation, nutrition, and a lot of that has to do with how we're trained in medical school.
Yeah. And so what are the statistics again for America? Again,
America has 100 million with diabetes. 50% of those are over the age of 65, and 1/3 of those people don't even know they have diabetes.
That's
pretty staggering.
Amazing. Yeah. Yeah, we definitely need to get this information out. And how is this affecting society in terms of cost? Because we talked a little bit about that.
Well, over the past 10 years, the cost that has been spent has been $333 billion. 95% of all the funding that comes in is directed towards infectious diseases, communicable diseases, where we know that this diabesity is causing chronic, all of the chronic medical problems around the world, but we're redirecting our funds toward infectious diseases.
Okay, well right now we are going to go to a roll-in and take a look at this.
No! Oops. Yeah, sure. Let's go.
Moms everywhere are finding ways to keep kids active and healthy.
Works every time.
Get ideas, get involved, get going at letsmove.gov.
And we're back. That was a good roll-in. I like that. So I see that you brought guests with us today. I would really love to hear their stories, and I heard you put them on a diet, so
Right.
I want them to share their stories with us.
Wonderful. Okay, well, we have Cathy LaDawn Miller, and we have Mr. Ed Gillow.
Nice to meet you. Thank you for being here.
Nice to meet
And we're happy they came.
Yes, thank you.
We'll begin with Cathy, who is also my sister.
No.
She's going to share her
Millers.
story.
Miller girl.
We look a little bit alike, huh?
Okay, well, first off, I stopped eating red meat. I haven't been eating red meat for, I want to say, about 2 years now. And I
Okay.
went from that to jogging. So I started jogging, and then something said, Cathy, you should try running. So I looked behind me, make sure nobody was looking, and I picked up my feet. I actually really looked behind, and I started running. So
Good for you, girl.
I picked up the pace, so now I run every day for 45 minutes.
That's great.
So when the daylight saving times changed, then the problem came in because I would get home from work, it would be too dark to run.
Yeah.
So I got an exercise bike,
Great.
and it's right there in my room in front of my television set. So I'll have a cup of coffee, which gives you energy, keeps you going. So I'll get on the exercise bike. I started off with 30 minutes, and I went from 30 to an hour. And now every night is 2 hours, and sometimes I can push 3 hours straight.
Wow.
That's great. So you've been feeling better, and actually, I'd like to take a look at the before and afters. I
Sure.
heard that you brought those. So there you are before,
Bye.
and here's the new you.
Yes,
Ta-da.
exactly. Still a work in progress.
Well, you look fabulous.
Thank you very much.
Yes.
Thank you.
And your
And,
son tries
yes.
to get on your exercise bike, right? Isn't
Yeah,
that
every
what you
now and
said?
then he'll
Shannon
get-
tries
yeah.
to sneak
So
on
now
there and-
your family, it's contagious what you're doing.
Oh, and coworkers too. I had a lady at work purchase one, so she's purchased one also. And I keep my
great.
eye on the coworkers, and if they pick up something they shouldn't be having, I'll say no, no, no. Watch your health.
Because
So,
you're
yeah.
changing people's lives. It's
Yes,
really good
most
that you're doing that.
definitely.
And
You
so I'd
don't,
like to
you
hear
don't
your-
miss any of the
Oh,
fast food?
no,
and
not at all.
Junk
Not-
food? And
not one bit of it.
Salty, sweetened?
Strictly water. I love water. That's all I drink.
It's good to be addicted to water.
Most definitely.
Definitely. So let's hear your story.
Well, the short of it is that Dr. Miller saved my life, in that I've always had a problem with high cholesterol, but you really don't have a handle on how it's building up in your body. And a calcium score that I had several years ago showed roughly a 30% occlusion, but in a very short period of time, it quickly grew to 90%. So without her pushing me to go to a cardiologist to check that out, I wouldn't be here today.
Wow.
But my background is I've always been an athlete, always stayed in shape because I knew about the high cholesterol. But my body's just not able to process it accordingly and keep that from building up inside of me. So with the plant-based diet, my hope is that it reverses it and just clears that stuff out. Because exercise doesn't get you all the way there. It's just part of
Right.
the equation. But what you eat is the main thing. Because now with the diet, I can control what I put inside of me, whereas before, I was at the mercy of Taco Bell and all these other people. And,
Right.
you just don't want to be there with
Right.
them. So that's basically it. So I owe her my life and a better eating style for sure. So,
Thank you.
yeah,
Wow. Well, I'm proud of
Thank
you
you.
for doing it too.
Yeah.
And thank you for finding that. But
Thanks.
it is true, you are what you eat.
That is
And
a true
that-
statement.
You are what you eat. So,
Right. And
So-
unfortunately, the first warning sign of coronary artery disease is in 25% of people, sudden death. You may not have a symptom at all. You feel 100% fine. And 25% of people, they die. And little is it known that the majority of people, their cholesterols are around 200. They're not extremely high. People think
Right.
you have to have a really, really high cholesterol. But until your cholesterol gets to be under 150 as your total, you virtually don't see any heart disease,
Wow.
with a total cholesterol below 150. And so you can ask many people, what is your cholesterol
Right.
levels? And they think 200 is great or 180 is great because the doctors aren't getting that information out. They're not sharing that information. And so it's taxing our healthcare system millions of dollars every year. We
Right.
spend $500 million every year on cardiac procedures. So
Right,
there's
right.
there's just no excuse.
so let's put a stop to this and let's talk about some of this great food that's on the table. Like, can you explain a little bit what we should be eating and putting in our bodies?
Absolutely, absolutely. There are certain foods that should be certified organic.
Yes.
And if you can't buy anything else, at least choose those primary foods.
Yes.
Or avoid or eat something else if you can't. So what I have demonstrated here on the platter are a lot of those foods. I'll point them out. Always buy organic if you can.
Yes.
Apples, imported grapes, the nectarine, the celery, the sweet bell peppers. You have your lettuce, the collards, the kale,
Yeah, so important.
and the spinach. Also, you want to always buy, if you can, organic coffee or not at all, because the coffee beans have so many pesticides.
I do that, yes.
Right?
Yes, organic is better.
And then if you have the grapes, and they have this very thin skin, and in the vines of the grapevine, pesticides collect just because of how they're arranged. If they have it, then of course also then your wine is going to have it.
Right.
So it's not really that hard to remember. You know, the grapes and the wine, pretty straightforward. You have very thin skin on the apples and the strawberries. And of course, when you spray a tree with pesticides, then you're going to have the problem with the nectarines and the peach. And of course, you have a potato underground for quite a bit of time, and the skin is pretty thin. So that's pretty much an easy way to remember.
Look at the skin and
Right.
pretty much figure it
And
out.
then the chocolate is the other. So to have a really good dark chocolate, which is full of antioxidants,
Yum.
you want to make sure the cocoa percent is at least over 70%.
Okay.
So less than that, it's really not ideal, but over 70%, it's a great antioxidant.
Well, I'll be getting some of that today.
Some of that.
And then also, what do we have here? We have granola. So
Well,
this
you
is
eat
better
some of
granola.
those things, right?
I do. I
Well,
do.
then tell me what you eat.
I love
you
it.
eat this
Yeah.
stuff. So you have
Yeah.
some favorites up here?
Organic and favorite. Yeah, almonds. Usually nuts. Those are good protein. And
Yeah, they have the fiber, the minerals, an excellent source of protein.
Yes.
But with the nuts, you don't want to eat as many as you can.
right. Yes.
So at most 2 handfuls a day.
Right.
And no more than that because there are so many
'Cause
calories.
it's still fats. Right.
Right. They're good fats,
Good
but too
fats,
much of
but
anything is not a good thing.
Bad. Yeah.
Right.
And then I also do brown rice spaghetti, but
Right.
yeah, that's
Just make sure it's organic.
Organic.
Again, these are organic. And then we have some of the brown rice
brown
here,
rice. Yep.
which is a good selection. And it's so easy to do. If you make the brown rice, you boil it and then you let it cook 25, 30 minutes, depending on the brand.
Yeah.
And you can reuse it over the next 3 or 4 days. And all you do is chop up a few veggies, saute it in a little bit of olive oil. The exception to that is if you have heart disease or you're trying to prevent heart disease. According to the movie Forks Over Knives, this is an
Yep.
excellent book.
Yes.
It was written by 2 physicians, and it was based on a study in China where they looked at the diets and how the incidence of cancer was substantially larger in different rural areas, and they had different diets.
Yeah.
So they mapped over several years, and they came up with all this data, making an association. And the bottom line to all that was, if you weren't eating a plant-based diet,
Right.
then you had an increased incidence of every major disease across the board.
Right. So why not eat plant-based so that you don't
Right.
have
And then switch to plant. You know, if you haven't
Right.
already, if you
Right.
switch, there is no surgery, there is no medication that will reverse your illness.
Yeah.
Only thing we know if that will is your diet.
Yes. Yes.
So imagine if everyone made some changes.
Right.
You wouldn't need me. You wouldn't need doctors.
We
right?
need you. We still need you.
But you know what I'm saying.
I actually
and
have
for
a
people
story.
who don't have insurance
Yeah.
also, you can't
Right.
afford to. But
Right.
you can't afford not to invest.
You can. Yeah.
And we keep getting it banged across our head, and you have to really think about it. I mean,
Yeah.
you know, you feel good now, but what are your blood numbers really show?
Right.
Are you really deficient in the different vitamins? Do you need vitamin D, which is associated with cancer? Do you have the pre-diabetes and you don't know it? Because pre-diabetes in and of itself, 4 times greater risk of heart disease, and it is the #1 cause of early dementia, #1. So we're living a lot longer,
Ugh.
but what's the point if we're going to
Yeah.
have dementia and we're sitting in a chair somewhere and
It's
don't know
definitely
where
not
we
what
are or
anyone
our
wants.
reality?
Yeah.
Right?
Right.
4 times greater, heart-related diseases in the
Yes.
pre-diabetes as well.
Yeah, I actually had trouble with my gallbladder for a little while where they were saying it wasn't functioning as well and said that I needed to take it out. And
That wasn't me. No, I know
it
I
wasn't
didn't.
you. Oh no, I wasn't going to then. And I said, no, no, no. And the surgeon was like, you have to take it out. There's nothing you can do. And I said, well, can I try to eat differently? Can I try? And so I did, and I saved it.
Wow.
And now I don't have any problems at all. So
And when you go back and
it
see
is possible.
those same doctors, what they'll tell you is, you know, we had a mix-up in the diagnosis. It couldn't have been. They just
Right.
don't accept that this is possible. But over time, you know, the word is getting out and things are changing. It's sort of
Yes.
like the same problem with DES. And DES was used between 1938 and 1953, and it was a estrogen hormone that was used to prevent miscarriages. Well, they knew in 1953 that it gave these women breast cancer. They knew in 1953.
It's
And the
horrible.
drug stayed on the market until 1971. It tells you how powerful, you know, the healthcare people are.
Right.
And they only stopped then when those mothers had daughters, and those daughters had a rare form of vaginal cancer. You know, that's criminal.
Yeah, it is. It's
Right,
causing
but-
people to be sick.
At some point, we've
Yeah.
got to take responsibility.
We've
you
got to
can't
do
say,
what we
I
can."
didn't know,
Yes.
or wait until you have severe illness to make those changes. I mean, why wait?
Yeah. Why wait? Life's too short to wait.
Right.
Yes. So what about the toothpaste over there? I see it. So
Well, if we're going to try to limit the toxins
Yep.
that we take in,
Yep.
There's things you can do by using a natural toothpaste. There's even a difference between, I thought this was interesting, organic, 100% organic cotton tampons.
oh my gosh.
Oh, they're synthetic tampons. They have
Yeah.
artificial things that you would be,
Oh no,
you know,
a lot of women can't even wear them because they feel sick when they wear
right.
them.
They literally feel
'Cause the
sick because there's chemicals
inside.
in here that don't
Yes.
belong in our bodies.
Right.
So it's all these little things that add up to be big things, and then you
Yeah.
feel better. And everyone
Yeah.
wants to lose weight. And so
Right.
I say, okay, well, if you're putting in toxins in your system all the time, and your body has to work to metabolize or try to excrete it, and these toxins are stored in fat, it's just much harder to get your metabolism going.
Yeah. Exactly. And this helps so much with so many things. And
Right, even for dogs.
Yes, even for our
A
pets.
lot of people, unfortunately, will take better care of their pets than they'll take care
They
of themselves.
do. That's true. Yes.
Right? And
Yeah.
we've just got to do a better job. And there are some really tasty things here. It's just a matter of experimenting and try what you like.
Yeah, and even with milk, raw is better. Correct. Raw.
Right. Right. You're going to have the natural enzymes. So if you look at the calorie count, you have 1 cup, 150 calories. And on this one, you have 1 cup, which is 90 calories. But it's not the total calories, it's what's inside, the ingredients.
the ingredients.
So when you start looking at names you don't recognize, so it's got filtered water,
Right.
soybean, calcium carbonate, natural flavors, carrageenan, something, vitamin, something, you know, we don't know what this stuff is, and
Right.
neither does your body recognize it.
Right.
So this is full of nutritious calories that are good for your health, and it's gonna do what? Prevent,
Prevent.
treat, cure, and
Cure.
reverse
Yes.
disease.
So that's, we're wrapping it up today, but that's basically what it's about. Prevent,
Yes.
cure, treat, treating disease. Thank you so much for being here.
You're so
Angela
welcome.
Miller, you
It's
are
my
great.
pleasure.
Thank you for being on as well and sharing your stories.
Sure,
you.
you're welcome.
And let's all be healthy, and we'll see you next time. See you later. Bye.
This program has been sponsored by the Trinity Broadcasting Network and made possible by your telephone dollars. Your continual support can keep Joy in Our Town brought to your home every day. So write Joy in Our Town, P.O. Box A, Santa Ana, California, 92711.